How long does Gonadorelin take to work? This is one of the most common questions men ask after starting Gonadorelin. They want to know, when am I going to notice the same benefits I've noticed on testosterone replacement therapy, or when will I start producing testosterone on my own? And so in this video, we'll deconstruct what Gonadorelin is, what pathways it works on, how it functions as a signaling molecule, and then some of the things you can expect as far as when you'll start noticing results. And I'm Regan Archibald. I'm the founder of Ageless Future. I believe that health is your most valuable asset, and I make these videos so that we can all learn together and optimize our health so that our next decade is our best decade. For those of you looking for a performance-based medical program with peptide cycling and pulsing through 503A compounding pharmacies, go to agelessfuture.com and my team will help you get connected. All right, so Gonadorelin, this is a gonadotropin releasing hormone, and it sends this pulse signal from your hypothalamus to your pituitary down to the testes. And when dosed correctly in a pulsatile fashion, it binds directly on these receptors in the pituitary gland, and the pituitary gonadotrope cells trigger the release of luteinizing and follicular stimulating hormone, which those are turned off when we're on testosterone replacement. But that luteinizing hormone, or LH, travels to the testes and signals your Leydig cells to produce testosterone. The key phrase is pulsatile, because if you think about this gonadotropin releasing hormone, its exposure is just meant to be in pulses. And that's where testosterone levels are going to be higher in the morning, and then they're going to drop and then raise up a little bit and drop. It's not meant to be continually and chronically activated, similar to growth hormone. If you're on growth hormone and you're not doing it in pulses, this is where, like CJC or ipamorelin, these can be really helpful just to give you a nice little pulse of growth hormone. So Gonadorelin is a great peptide. Most men reach out to us because either they want to get off testosterone therapy because their blood is too sticky, they're worried about strokes, or they feel like their moods change too much and the testosterone, they can't find the right dose, their testosterone is going too high and then too low. They also come because they want to be on something that they feel is cleaner. Now, I'm a big fan of testosterone replacement therapy. Our women who are on it, they do phenomenal. Gonadorelin, though, for men, we find that men, no matter what age, we can still produce testosterone. And when you can produce it on your own, that's when you get the highest quality of testosterone. And Gonadorelin is a great peptide because it does trigger your body's own release of testosterone. And this typically happens within the first month of consistent treatment. So in the 2025 PMC study, they compared pulsatile gonadotropin-releasing hormone therapy to HCG in men with congenital hypogonadotropic hypogonadism. And what they reported is that serum testosterone, both of these therapies maintain normal serum testosterone throughout the treatment, and adjustments were made at week 6 and week 12 for men on TRT using Gonadorelin specifically to maintain testicular size or to stimulate the suppressed pituitary. And what they found is the pituitary was not deficient. It was suppressed by exogenous testosterone, but Gonadorelin's ability to overcome that suppression, they found that it helped with the pulsatile administration. And so a lot of times in that first month, when you start pulsing it, and the pulsatile may be every other day or twice a week. And they found if spermatogenesis, so once again, 30 days is about when you can see the first responses of luteinizing and follicular stimulating hormones. Those are the pathways you want to look at. So in the same 2025 study, they found that pulsatile growth gonadotropin releasing hormone therapy first induced sperm appearance in approximately 6 to 8 months. So they found that was notably faster than the HCG therapy, which takes approximately 9 to 18 months. So if you're looking to have babies, give yourself at least a 6-month window so that you can get some really healthy sperm ready to get called into action. An earlier study reported sperm emergence time of 6.48 months with pulsatile gonadorelin. So that's pretty darn good. They found with erectile function, secondary sexual characteristics like pineal length, testicular volume, morning erections, in men treated with the hypogonadotropic hypogonadism typically improved after about 3 months of treatment. Now, if you have sexual dysfunction, maybe consider like PT-141, even melanotan-2 if you're also looking to get a little bit of a tan on your skin and protect yourself against inflammation. You may notice a little quicker improvements in that, especially if you use the date-night special. PT-141, oxytocin, and tadalafil work incredibly well together. If you think about the lab changes, sometimes you feel changes, but your labs haven't improved yet. And testosterone, most men, when you get on it, you're going to notice a big improvement and you'll notice a big jump in your labs, but that doesn't last long term for many men. Many men notice that in that first 6 months to a year, they feel like themselves again on testosterone, but then the results start to wane and they start noticing that they don't have the same kind of morning erections, the same like improved mood. They also notice that their testicular volume starts to shrink. And so they notice that within the first 4 to 8 weeks on many men of the testicular volume changing. So the reason why we create this framework of test, target, treat, and then track, and then tune based on what we're tracking, it means that we need to collect all the symptomatic data and lab data because neither alone is sufficient. And so where we like to start is go luteinizing hormone, follicular stimulating hormone, total testosterone, free testosterone, estradiol, sex hormone binding globulin, prolactin, and then CBC, CMP. These are really important so that we can see exactly where we're starting, what your benchmark's at. What we're targeting with gonadorelin is we want to target that pulsatile gonadotropin signaling pathways so that you can optimize your testosterone and preserve testicular function. And then gonadorelin, it's a prescribed peptide. Don't self-administer this. And the frequency is going to be usually every 2 or 3 days. And then we want to look at your labs within the first 90 days to see how are things coming along. Are we increasing your luteinizing and follicular stimulating hormone? Is that transferring over to testosterone? Are you making enough? On you, subjectively, you want to be tracking, is your scrotal volume feeling greater than it was before? Are you getting more morning erections? How's your libido, your energy, your mood? And if we haven't seen the luteinizing and follicular stimulating hormones increase with that first blood lab, then this is where we may want to bring in like Enclomiphene, which is a selective estrogen receptor modulator. And I have many videos on Enclomiphene, so we'll provide a link in the show notes if that's of interest to you. We find that cycling through Kispectin, Gonadorelin, and Enclomiphene, it allows us to work on different pathways in the brain without oversaturating one pathway or the other. In some cases, especially in fertility, using Gonadorelin with like Enclomiphene or Kispectin can increase the speed in which it takes for you to have that spermatogenesis occur. The other thing we're tracking is your PSA. This can be a big part of the problem. And then the most important thing that you want to look at is what turns off the gonadotropin releasing hormone pathway. And it's stress. It's that psychological stress that we have. And so this is where spending time practicing mindfulness, meditation, exercising is my stress relief. But those are all really important things. And then making sure you're getting rid of chemicals. Make sure you eat organic, grass-fed, grass-finished beef and bison and lamb, elk. These are all really good for testosterone production. Make sure you're getting some seafood in, so you're getting some fatty acids and selenium, also really good. And then eating eggs can be really good for overall sperm production. And then avocados, roughly a half of an avocado a day with some Brazil nuts can help improve your testicular volume and give you the fatty acids that you need. And so if you're somebody who wants to go deeper to find out if gonadorelin is the right treatment for you, all you need to do is go to agelessfuture.com, set up an intro call with my team. They'll help you get the right testing ordered, or we can look at the labs you've already had ran. If you're somebody who's proactive about their health, we can help you. agelessfuture.com. I'm Regan Archibald. I'll see you on the next video.